we're gonna see if we can get Dr. Murray's attention here for just a few seconds to answer a question for us.
Sure.
Can you tell us a little bit about patients who come to see us who have back pain, neck pain, any kind of pain where they think they should have had an x-ray and they didn't get one? And why didn't they get one?
A lot of the time people want to see what their problem is on an x-ray or an MRI because they think that's the reason why they have their pain. But quite often that's not the case. There usually is a lot more to why they have pain than just what's on that picture, what's on that image.
So will that actually show something useful? If they were to get an x-ray, will it show something actually helpful in their situation?
Yeah, there's always the possibility that x-rays will show something that you need to take care of, but you usually have a good idea of what that's going to be ahead of time. You don't just order it and go searching. You need to have a good reason.
And what would the possible risks be of getting an x-ray when maybe you don't need one?
A lot of the time, if you take an x-ray and you don't really need one, well, first of all, it costs someone money. And if you're doing a lot of those unnecessarily, it just costs more money than what it's worth. But more importantly for the patient, it may make them think that they're dealing with a bigger problem than what it really is. They may choose to not do things for themselves like exercise or just keep doing things without worrying about their daily activities.
So what if the x-ray were to show something that actually isn't contributing to their pain? How could that negatively affect a person?
Well, often we'll hear about people who have an MRI and it will show a disc herniation, and they'll assume that that disc herniation is a major problem that they'll need to have fixed. But a good number of people are walking around all the time with disc herniations and it doesn't give them problems ever. So it just doesn't mean that it's a problem you have to look after.
And what about nocebo effect? Can you briefly explain what that is and how that can apply in this situation?
Nocebo effects are ones where what you see on an x-ray or what a doctor might advise you to do actually has a bad effect. It makes you worse as opposed to making you better. So thinking that you have something on an MRI that you may go off and do something about that you didn't need to, you may have a surgery that you didn't really need, for example, you may end up feeling worse than you would have if you didn't have that happen.
Good, thank you.